I typed a response to this, but I just had to respond with a video also because this is where I really nerd out as a counselor. I'm Carrie, I'm a mental health counselor turned school counselor, and the absolute favorite thing about my job is group counseling. So typically when selecting students for group, I'm basing all of my decisions on data. I look at things like behavior data, academic data, attendance data, frequency data, anything I can get my hands on. For example, if I'm seeing that there's a handful of students in a particular grade who are constantly having behavior referrals for arguing at recess or having some sort of conflict at recess, then I might pull those students for a small group on conflict resolution. Or if the academic data shows that several students struggle with turning in their assignments, they have a lot of missing assignments, then I might pull them for a small group on executive function or organization. I could talk all day about group counseling and all of the things before, during, and after that I do. I have a lot of professional development around this. If you're interested in that, please let me know. I can send you links to check out all the different options that I have. But for this particular group that I was showing, it's a girls group, our friendship group, and I noticed based on data I was having lots of counseling referrals for fourth grade girls as a whole surrounding friendship issues, and this was happening year over year. I was dealing with it in the moment kind of in a responsive way, so I decided following year I was going to do intervention with the fourth grade girls in a preventative way. So during our intervention block at school, which for fourth grade is twice a week, Tuesday and Thursday for 45 minutes, we have 3 trimesters. So for the first trimester I pulled a handful of girls from fourth grade, the next trimester I pulled another handful, the next trimester I pulled another handful until I got to all of the girls in the grade. So I was doing it multiple times just to make sure that I could get to everybody, but it worked out really well because I was able to see all of the students. They all got the same instruction and intervention around friendship skills outside of our regular tier 1 instruction. Really good news about that is I did see a decrease in the counseling referrals for peer conflict with those students in that grade level. Anyway, like I said, I have tons of PD around group counseling. If you ever want to check any of that out, please let me know and I can send you the links so that you can look it over.